So next we'll be starting with the renal system. So under the renal system, we'll be discussing the following headings. So we'll start with the normal structure of the kidney. Then we'll move on to the glomerular diseases, which is both the nephritic and the nephrotic syndromes. Then we'll see about the systemic diseases which affect the kidney. Then the tubulointerstitial diseases and the cystic diseases of the kidney. Then the renal tumors. Then the various microscopic features of urinary examination. And then urinary bladder tumors and malakoplakia. So let's start with the normal structure of the kidney. So this part of the kidney which is going to be called as the glomerulus. So this is the first part of the disease we'll be dealing with. So the first part of it will be the afferent arterioles which start and then they branch into the capillary tuft, which are then surrounded by this parietal layer and visceral layer of the Bowman's capsule. So this constitutes the Bowman's, the space between this parietal layer and the visceral layer. This space constitutes the Bowman's space, which is also called as the urinary space. So in between these capillary tufts, we are going to see some mesangial matrix, which are laid down by the mesangial cells. So mesangial cells are nothing but the modified macrophages of the kidney. Then what happens is the glomerulus, where after that it will continue as the proximal convoluted tubule, and then it will then lead on to the loop of Henle. So the descending loop of Henle will be there, then the ascending loop of Henle, which then continues as the distal convoluted tubule. Then this will all end up in the collecting duct. So this is the normal structure of the nephron, which is the functional unit of the kidney. So let's see in detail about the filtration membrane. So this filtration membrane is nothing but this part of the membrane. I am going to draw it in detail. So this part is going to be called as the filtration membrane. So it is a tri-layered membrane wherein this normal filtration of the urine happens. So the first layer will be the layer of food processes. So this is the outermost layer, which is also called as the podocyte layer. So these are nothing but the visceral layer of the Bowman's capsule. So these podocytes will have this structure. So in between these podocytes, there is going to be a space which is called as the slit diaphragm. So the slit diaphragm is also important. Then the next layer, the middlemost layer will be the basement membrane on which these podocytes are resting. So this basement membrane is again having three layers. So the outer two layers will be the lamina rara. So lamina rara are the outer two layers, while the inner thicker layer will be the lamina densa. Okay, and the normal thickness of the basement membrane will be 300 to 400 nanometer. And the innermost layer of this filtration membrane will be composed of this fenestrated endothelial cells. So these are the endothelial cells which are having a gap in between, which is called as the fenestrated endothelium. So what is the importance of this filtration membrane is that these are going to be negatively charged. So these are going to be coated with this negatively charged protons. So this negative charge is responsible for repelling whatever negatively charged protons are coming. So normally the protons which are going to be negatively charged will not be filtered through this filtration membrane because they will be repelled. So when this negative charge is being lost, that is when protons like albumin and other protons are going to be filtered and excreted through the urine. So that will be the basis for one of the glomerular diseases, especially minimal change disease, which is a nephrotic syndrome. So for every kidney disease, we'll be discussing the light microscopic features, the immunofluorescence and the electron microscopy. So electron microscopic images, the normal electron microscopy you must be familiar with, only then you can understand the pathology part of it. So this is the electron microscopy image of a normal kidney. So in this, if you see this part, so all of these cells are the outer layer of the filtration membrane, which was composed of the food processors or the podocytes, right? So this is the outermost layer. Then comes the inner layer, that is the lamina rara and lamina densa of the glomerular basement membrane. So if you see, this outer two layers here are kind of light in color, but the inner layer will be dark in color, this part. So this is the lamina densa. So the violet one I have represented the lamina rara and the blue line is representing the lamina densa of the glomerular basement membrane. Next, the innermost layer of this filtration membrane will be composed of the endothelial cells. So the endothelial cells I'll represent in the pink color. So these are the endothelial cells which are present on the inner surface of the filtration membrane. And this part which is going to be there, this is the capillary lumen. So if you understand this, you will be able to understand the pathology part of it.